We are joined today by Kathryn Bruns, a certified nurse practitioner with Lima Memorial Hospital, and she's here today to talk about when we should utilize walk-in care versus making a trip to the emergency center. So first, can you give us a little background on this topic, why it's important to know the difference between the two, walk-in and emergency?
Good morning, everyone. Thanks for joining us. So walk-in cares are a little bit different. We service populations that maybe don't have primary care providers, and that would be someone that you would routinely see. So if there is, let's just say a situation like you wake up and you're sick that morning, we're available for anyone to utilize our walk-in care facility. Our hours are usually Monday through Friday, 8 to 8, with Saturday and Sunday possibly being open until 8 to 2. So we are for non-life-threatening emergencies. And that would be something like sore throats, ear pains, maybe urinary issues, cold flu symptoms, coughs, or just some of the other things that we can service. A little bit different versus urgent cares. Urgent cares usually have x-rays and labs on site for people, such as like broken bones. What else? If you maybe require suturing, that would be more like an urgent care situation versus our walk-in cares.
Okay. So what are the differences in costs that are associated with walk-in versus emergency?
Good question. So usually a lower copay. Usually as a walk-in care patient, you're being in an office such as like your primary care. Behind me is like our setup here. So the copay is usually cheaper. It's like an office visit that you would pay your primary care, ranging from like 25 to 50 usually. And then the cost altogether would probably be a lower care since the acuity should be lower. The ER visits, you're usually looking at over $100 for a copay.
Normally, I know most people, their very first thought is, oh gosh, we've got to go to the emergency room, but that's not always the case now.
Right. So we would try to leave the ER visits to be more life-threatening situations. And those would be the chest pains. Those would be the shortness of breath. Maybe you have a large cut. Maybe you're on blood thinners. If you hit your head or have any traumas, those should be going to the ERs. Simple things like sore throats, colds, stuff like that we can treat. We would welcome with open arms because, again, if you're going to the ERs for that, then you're taking away the possible care that other people may need that are more life-threatening.
Okay. So if someone wants to schedule an appointment with you, obviously if they're coming into the walk-in, they just walk in. But what if someone wants to schedule an appointment with you? How do they go about that?
So they can call our Lima Memorial Help Desk, or like the main number here. Our direct line is 419-227-5298. We do accept patients. So if you utilize our walk-in care quite a bit, it's great to maybe set up an appointment and we take you on as patients here. So when you are sick, you can at least be seen same day and not have to wait for appointments.
All right, Kathryn Bruns, thank you so much for your wealth of information this morning, and we will be back with more right after this.